Dr. Oz, great to have you with us. Let's jump right in and start with a headline a lot of people are tracking right now. President Trump's executive order to speed up research into psychedelic drugs. It specifically mentions ibogaine. Dr. Oz, in your eyes, who benefits the most from this, and what do you believe is the biggest risk?
There's lots of tantalizing evidence that altering the way people view the world around them can benefit folks with post-traumatic stress disorder, refractory depression, a whole slew of conditions. And ibogaine is a drug that has very low addiction potential because apparently it's such a miserable experience you would never do it for fun. But it does tend to reset people in ways that may benefit them. It also may have some neuroregenerative benefits, which means it might help brain cells recover. So if you had traumatic brain injury, which is often associated with the post-traumatic stress disorder, depressions, anxiety, some of the things that folks can be afflicted by, and maybe even with substance use disorder as a coping mechanism, it could be helpful. Veterans have been swearing by it. Lots of Americans have been going overseas to get this program. Joe Rogan has talked about this, both on a show, but also with the president. And as the president began to realize that not just ibogaine, but other psychedelics like MDMA, psilocybin, magic mushroom, these are drugs that have been around for a long time, but they do have, in that case, they've been used as a street drug, but they might have therapeutic benefits when used appropriately by skilled practitioners. And that's why the president insisted on this executive order, which was executed last Saturday. And we've gotten a remarkable amount of positive feedback because these conditions are really difficult to manage, and the success of traditional pharmaceutical drugs is limited.
Dr. Oz, with the time we have, I want to switch gears and talk about what's next for the MAHA movement as well. The list of accomplishments already stacking up, it is admirable. RFK Jr. saying he wants to clean up the food supply, starting with removing hazardous synthetic food dyes, tougher scrutiny on food additives as well. And just this week, we see lowering prescription drug prices, a big deal with Regeneron, the 17th pharmaceutical company to lower drug costs there. Now, we know not all Trump supporters are satisfied. The group calling themselves the MAHA Moms, they've been really vocal in their disappointment in things like increasing the production of glyphosate, that weed killer linked with cancer, rolling back the limits on forever chemicals in our drinking water. Dr. Oz, do these MAHA moms have a point? Should there be no compromise when it comes to the health of Americans?
Well, the president is pushing for the health of Americans. The unfortunate reality with glyphosate, which is Roundup, is that American agriculture is addicted to it. And you need to give the farmers time to be able to move off that product into other ways of growing their crops with the same efficiency. And this should have been done years and years ago. I remember talking about these kinds of problems on my show at least a decade ago. And the president finally just wrestled this down and said, for now, we got to deal with this issue that's in front of us, which is making sure that food is affordable in America and that our farmers are protected. But we're going to quickly, I think, over time, you'll see as science now starts to focus on this problem, address it. But the broader narrative about MAHA is about making it easier to be healthy. And if you look at what the administration has accomplished, it's remarkable. You mentioned some of the issues around things like food dyes. Obviously, if the food you're about to put in your mouth has stuff that other countries don't let manufacturers use, that's a concerning issue. But we're also focused on plastics. We're looking at things just in my area of specialty, which is CMS, Medicare, Medicaid, of making healthcare expenses more affordable, making sure that you have access to medications at an affordable price so that if you do have a chronic problem like diabetes, you can take the medication that can treat your diabetes so you don't develop chronic illnesses from it. And you touched on it briefly, but just to underline this, pharmaceutical prices in America are so high that 1 in 3 Americans leaves the pharmacy, you see right there in that image, without the drugs they went there to pick up, despite the fact their doctor told them to take that medication. So the president said, enough's enough. We know we pay 3 times more on average than a European pays for the exact same product, made often in an American facility. So he's insisting that we have most favored nation pricing, which means very simply, whatever you charge overseas, you charge to Americans. Our drug prices, therefore, some of these really important ones like the weight loss drugs, the GLP-1 drugs, they now plummeted in price. Americans can afford them. And the good news is, as we get them more readily priced, it actually ends up saving our country money because by making Americans healthier, by reducing, in the case of these GLP-1 drugs, the amount of obesity we have in America, we have less diabetes, less hypertension, and all the complications that would have normally arisen no longer happen. We save money.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.